You need to know the name of the movements that you are doing. So flexion, extension, abduct, adduct. You need to know the names of the motions that you are doing, okay? All right, now this is neuro. Neuro has a lot more parts to it, okay? Hand hygiene, pulling my curtain, scene safety. Hi, my name is Jen, and I'm going to be your nurse today. Can I have your name and date of birth? May I see your bracelet? Puneet, 2006, thank you. Do you have any allergies? Any cultural considerations I should be aware of? Okay. I'm here to perform a neurological assessment on you. Is that all right with you? Okay. So, when I'm talking to my patient, I am assessing her level of arousal. When I walked in the room, her eyes were open. When I asked her a question, she spoke to me. So she is arousable to verbal stimuli. If I walked into the room and her eyes were closed and I said, Puneet, hi, and then she opened up her eyes and said, oh, hi, how are you? That would be that the patient is arousable to tactile stimulus. If I went into the room and said, hi, Puneet, how are you? Puneet, hello. And then I had to perform something painful, you can do a sternal rub. So the breastbone, the sternum, you can rub on the sternum. I've seen some nurses do some pretty gruesome things, so I will stick with a sternal rub, or you can put some pressure on the webbing between the index finger and the thumb, and that will usually arouse them, okay? So being that I walked in the room and my patient, her eyes were open and she responded when I spoke to her, she is arousable to verbal stimuli, okay? Her Glasgow Coma scale is a 15, so we are measuring eye-opening, verbal response, and motor. So you don't need to memorize, just know that the higher the Glasgow Coma scale, 15 is perfect, the lower is not so good. Okay, so higher is better, lower is not. It can indicate a brain injury, all right? So then I'm going to do my general survey here. I am assessing, I'm looking visually, I'm assessing her grooming, I'm assessing her appearance, her attire. Now she is in a hospital gown, but if she were not in a hospital gown, I would be assessing, is she dressed appropriate for the season, for her age, for the situation. I am notating her posture, her motor behavior. Are there any tremors? I'm notating her gait, which I'll have her walk in a minute. But I'm notating her personal hygiene. Her hair is well groomed. Her face, you know, she doesn't have any body odor. Her teeth are intact. Then I'm going to determine her level of consciousness, her LOC. So, Puneet, can you tell me, you've already told me your name and date of birth, can you tell me where we are? We are at Drexel University. Can you tell me the date or the month and year?
February 2026.
2026, thank you. And do you know why you're here?
The lab.
For your lab assessment. Excellent. So, my patient is awake, alert, and oriented to person, place, time, and situation. AAO times 4. Now, we have a little wiggle room with time, okay? I'm never good at the date. So I asked her, can you tell me the month and the year? I could ask her, what holiday did we just have 2 weeks ago? What season is it? So that could give you some indication if she is alert to time, okay? So I would tell you that today is February 20th. It's the 19th. So I'm not good at dates. So you don't need to consider me not oriented to time because I didn't know that today was the 19th. Give your patient a little bit of a benefit of a doubt, okay? And give them some options, all right? Okay. So my patient is awake, alert, and oriented times 4. Person, place, time, and situation, okay? So when we are talking, I am notating her characteristics of speech and articulation. So is she speaking super loud or super soft? Is she speaking very fast or very slow? And is she able to say the words properly? Does it sound like she has marbles in her mouth, or is she speaking properly? Then I'm going to assess my patient's cognitive functions, okay? I'm going to assess immediate, recent, and remote memory. So you want to know the answers to these questions before you ask them, okay? Puneet, I'm going to repeat some numbers, and I'd like for you to tell them back to me. 1, 2, 3.
1, 2, 3.
7, 8, 9.
7, 8, 9.
Okay, now I'm going to make it a series of 4 numbers. 2, 4, 6, 8.
2, 4, 6, 8.
20, 40, 60, 80.
20, 40, 60, 80.
My patient's immediate memory is intact. Now, recent memory, again, you need to know the answer to this question. So you can't ask the patient, what did you have for breakfast today? Now, if I served her breakfast and I know that breakfast was French toast and a cup of coffee, I can ask her, what did you have for breakfast? I can ask her, how did you get to the hospital, if I know that she came in an ambulance or that her family brought her. So when you're asking recent memory, you want to make sure you know the answer to that question, okay? And then remote questions, again, you want to make sure you know the answer, and it's also appropriate for the patient. I'm not going to ask the patient, what year was the Spanish influenza? Because, who knows that answer? You could ask a question like, what day of the year does Christmas fall on? December 25th. So that's remote, where it's not right now, but it's an answer that people would know. On Tuesday, I used the example, what year was the Declaration of Independence signed in? And I got like crickets. 1776? Yes. So something that you know the answer to, that you think that your patient would know the answer to. Okay, so now I'm going to assess your cranial nerves. May I have you sit at the side of the bed for me? Thank you. Okay, so first thing I would like for you to do is you need to know the name and the number of all of the cranial nerves, okay? So the first thing I'm going to do is assess the patency of your nose. Can you occlude one nostril? Deep breath in and out. And now occlude the opposite nostril. Deep breath in and out. Okay, so I'm going to give you some smells, and I would like for you to tell me what you smell, all right? All right, close your eyes. What do you smell?
I have no idea what that is.
Coffee.
We'll make sure that they're very evident for you guys.
You drink coffee every day.
Take a guess. Cinnamon, okay. So, cranial nerve number 1, the olfactory nerve, is intact, okay? Cranial nerve number 2 is the optic nerve. Now, you guys have options, okay? You can use the Snellen chart, and there is tape on the floor where it's 20 feet from the Snellen chart, or you can use your Rosenbaum eye chart. Can you hold this at arm's length, cover one eye, and read the smallest print you can?
4, 2, 6, 7, 3, 9.
Can you switch hands and eyes and repeat the same?
4, 2, 6, 7, 3, 9.
Now, no, which one, is that this one?
That one.
Oh, geez. Now with both eyes, read the smallest print.
4, 2, 6, 7, 3, 9.
So patient is 20/20 in both eyes, bilateral eyes. And now I'm going to assess confrontation. So this is assessing peripheral vision. So I want you to look at my nose, and I want you to tell me when you see my fingers wiggling. You're gonna see this, okay? Okay, confrontation is intact. So now I'm going to assess the ocular motor cranial nerve, which is cranial nerve number 3. So I am going to be inspecting my patient's pupils, all right? So the first thing I want to do is I want to measure them. Patient's pupils are +3 bilaterally. And now I'm going to do correct and consensual light. So what that means is direct is I'm going to shine the light into the eye, and I'm going to look in that eye. Then I'm going to do the opposite eye. Consensual is I'm going to shine the light in the eye, and I'm going to look in the opposite eye. And what I'm looking for are the pupils dilating and constricting, okay? I'm going to shine a light into your eyes. Just stare at my nose. So that's direct, and now consensual. Okay. Can I have you follow my pen light with just your eyes? And that is called convergence, okay? So patients' pupils are equal, round, reactive to light, and accommodation. So that spells out Perlin, all right? So cranial nerve number 3 is intact. Cranial nerve number 3, 4, and 5, oculomotor, trochlear, and abducens, that assesses the extraocular eye motion. So we're going to do the 6 cardinal fields of gaze, right? So I want you to follow my pen light with just your eyes. Okay, so extraocular motions are intact, so cranial nerves 2, 3, 4, and 5.
6.
3, 4, and 6, I'm sorry. 3, 4, and 6 are intact. Oculomotor, trochlear, and abducens. Cranial nerve number 5 is the trigeminal nerve, and there are 2 functions. There's a motor and a sensory. So I am going to place my fingers on your jaw, and I want you to clench really hard, and then I want you to open and close, and then wiggle side to side. So cranial nerve number 5, trigeminal motor, is intact. Cranial nerve number 6, sensory, okay, so I am going to touch your face, and I want you to tell me if you feel dull or sharp. So this is dull, okay, and that is sharp. Can you tell the difference? Okay, close your eyes, and I want you to tell me if you feel dull or sharp.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
So cranial nerve number 5, trigeminal, sensory, is intact, okay? Cranial nerve number 7, facial motor. So I want you to puff out your cheeks. I want you to raise your eyebrows. I want you to smile real big and show me your teeth. I want you to whistle.
I can't whistle.
Well, then make the motion of whistling. Okay, so again, if you can't whistle, that's fine, but at least we want to see the, okay. So cranial nerve number 7, the facial nerve, is intact. Cranial nerve number 8, acoustic. So I'm going to stand behind you. Can you occlude one ear for me, please? I'm going to whisper a few words, and I want you to repeat them.
Shoe, golf, sign.
Okay, now I'll occlude the other ear.
Baseball, red, foot.
So cranial nerve number 8, the acoustic nerve, is intact. Cranial nerve number 9 is spinal accessory. So cranial nerve number 9 and 10, glossopharyngeal and vagus. Okay, so bless you.
Oh.
All right, can you open your mouth? Say ah.
Yeah.
So you're looking for the uvula. Does the uvula rise and fall? Can you swallow? And can you cough? So cranial nerves number 9 and 10, glossopharyngeal and vagus nerves, are intact. Cranial nerve number 11, the spinal accessory. So I'm going to place my hands on your shoulders, and I want you to try to shrug them as hard as you can. Excellent. I'm going to place my hand on your face. Tilt your head to that side. Excellent. And then the opposite side. Awesome. So cranial nerve number 11, spinal accessory, is intact. Cranial nerve number 12, hypoglossal. Can you say DTLN?
DTLN.
Can you stick your tongue out and wiggle it side to side? Okay, excellent. Cranial nerve number 12, hypoglossal, is intact. I'm going to now assess some coordination. So place your hands lightly on your thighs, and I want you to rapidly move them back and forth. Excellent. Okay. I want you to take your thumb and touch each one of your fingers rapidly and go back and forth. Okay. I want you to take your left foot and tap your toes. I want you to take your right foot, tap your toes. Okay. So I would like for you to take your left hand, touch my finger, touch your nose. Touch your finger, touch your nose. Touch my finger, touch your nose. Touch my finger, touch your nose. One more time. Excellent. Now with the right hand, touch my finger, touch your nose. Excellent. Okay. I want you to take your left heel and put it on your right knee. And I want you to slide it down your shin and then slide it back up again. And then I want you to do it with the opposite foot. Take your right foot, right heel on your shin and slide it up and down, okay? So coordination is intact, okay? Ooh, I'm a little discombobulated here. There we go, okay. So I would like to assess your gait. Now I know we assess gait with musculoskeletal, but that was with musculoskeletal. So with neuro, we would assess gait too. So can you stand up, take a few steps that way, turn around and come back. So gait is uniform and easy. Her length of stride are symmetrical and arms swing appropriately at the side. I'm now going to do the Romberg test. So I want you to just stand with your eyes closed, okay? So you place your hands in front of and behind the patient so that they are not at risk for falling. See how she's not moving? This is a negative Romberg test. This is exactly what we want to see. Can you sway just a little bit? So this would be considered a positive Romberg test, thank you. And that could be, there's something with the inner ear, or it could be something neurological. So what you want is a negative Romberg. You want, when you're standing here, for your patient to just be still, okay? All right, you can sit down. So I'm going to perform some sensation tests on you, okay? I'm going to do a light touch, which I'm going to use a cotton swab. And we start at the distal end and we go to proximal. So distal to proximal, okay? So I'm going to assess on your arms and legs. So close your eyes, just close your eyes. Okay, and I want you to just say now when you feel me touching you. All right, so now we are going to do a pain sensation. So it's the same test, all right? And it's going to be, again, this is dull, that is sharp. Okay, so close your eyes and tell me dull or sharp.
Sharp. Dull. Dull. Sharp. Dull. Sharp. Sorry. Sharp. Dull. 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 Sharp.
Okay, excellent. Now, if those two tests were abnormal, I would assess using temperature, where I would have two test tubes, one with really, really cold water and one with not super hot, but pretty warm, and we would use temperature to assess the same way. But since her two light sensations were intact, we don't need to do that. Now I'm going to assess vibration. So I'm going to touch your thumbs and your big toe with a vibrating tuning fork. I want you to tell me when you feel it start and then when you feel it stop, okay? So just put your hands on your thighs.
Okay.
All right, so.
Start. Stop. Start. Stop. Start. Stop. Start. Stop.
So vibratory response is intact. Now I'm going to do proprioception, which is positioning sense. So I'm going to take your thumbs and your great toe, and I'm going to go up, down, left, right. I want you to tell me what direction, well, side, side. I want you to tell me which direction I'm going. Close your eyes.
Up. Side. Side. Down. Up.
Okay.
Side. Up. Down. Side. Side.
All right.
Up. Down. Side. Up. Side. Side.
Excellent. So proprioception, which is positioning sense, is intact. Every time you touch the feet, always make sure that you clean your hands. All right, so now I'm going to perform discriminatory sensations. So close your eyes. I'm going to put an object in your hand, so put your hand out, and I want you to tell me what you feel. A key. All right, other hand, please. Paperclip, excellent. So that is called sterignosis. I'm going to perform graphesthesia. So I'm going to draw a letter in each one of your hands, and I want you to tell me what letter. Now, when you're doing it, make sure that you're doing it towards the patient. So if you're doing a V, you know, the V is towards the patient, because then they might be like, Okay, you ready?
W.
Okay, and good, excellent. So graphesthesia is intact. I am going to now perform a test called point localization. So you're going to close your eyes, and I want you to point to where I touch. Okay, now I'm going to perform sensory extinction. So I'm going to do the same thing, but I want you to tell me where you feel me touching, because I'm going to touch on both sides at the same time. Close your eyes.
My arm, hands, thigh, leg, feet.
Okay, so discrimination sensations are all intact. Now I'm going to assess your reflexes. This is the hardest part for me, so just know. All right, so first it's going to be your brachioradialis. So brachioradialis is about 1/3 of the way up from the thumb, okay? So just relax your arm. Okay. So then we are going to assess bicep. So you're going to take your thumb and place it on the tendon. You're going to hit your thumb with the pointy end of the reflex hammer, okay? Woo, I got a good one there. All right, and then I'm going to assess your triceps, which, thank you, sorry. You want to go in between the two bones of the elbow, all right? Okay. So remember, we do everything bilaterally. So brachioradialis. Ooh, I got it that time. Okay. And then tricep. Okay. So now can you scoot your hiney back just a little bit? Patellar, right? It's that squishy spot right under the kneecap. You're going to use the broad end of the reflex hammer because that gives you a larger surface area. There we go. Okay. And then your Achilles. Achilles, never use the pointy end of the reflex hammer. You always use the broad side. It is rare, but you could rupture the Achilles tendon using the pointy end. All right, so we want to hold our patient's foot, and you're going to tap the Achilles tendon, okay? And you're looking for the foot to jump. Last thing we're going to test is the plantar reflex, which is also called the Babinski. We want a negative Babinski, which means our patient is going to curl their toes in. We don't want to see them flare. Flare is a positive Babinski. In a child who has not yet learned how to walk, flaring, normal, A-okay. In an adult who's walking, flaring, not good. We want to see flexion. We want to see curling of the toes, not flaring, okay? You take the pointy end of your reflex hammer. You know what? I'm just going to do it high so that people can see. You're going to start here at the heel. You're going to start at the heel, and you're going to all the way around, okay? So there's no flaring, so that's good. Okay, so negative Babinski, and that is what we are looking for. We are looking for a negative Babinski. If the Babinski was positive, that could be a neurological issue. But again, in a child who has not yet learned to walk, that flaring of the toes, okay, completely normal. Questions? All right, happy practice. Yep, yes.
Some of the stuff that you did for like the neurological, like with the peripheral or like the eyes, you have to do for the. Oh wait, no. Do you have to do that? Is that part of the general like assessment that we have to do for checkout?
So not part of the general.
Or at least
it's
like,
part of
alert and
neuro.
awareness.
So Perla, you're going to check eyes on every patient, no matter what assessment you get. But you're going to go more in detail with testing the cranial nerves.
So if we get like while we're testing the cranial nerves, we just do it twice, like Perla.
I would, so that I wouldn't forget.
Okay.
Any other questions? All right. Happy